Hello student, we're starting the respiratory system. Our first discussion will be the assessment of the respiratory system. All right, next slide. All right, the respiratory system is divided, it's one of the systems that is divided into two levels, upper respiratory system and lower respiratory system. So what you need to understand, and then also you also have that it has its own function like the rest of the other system. And definitely with the respiratory system, you're looking at the supply of oxygen to the entire body. And it's not just to supply the oxygen, but also to remove the carbon dioxide from the body. So that's really, really important. So with the respiratory system, what you have is the air enters the respiratory system through the nose, right? So it's part of our system. So just imagine someone who has, an obstruction, deviated septums or polyps in the nose, that's going to be affected, right? So the air enters through the nose or the mouth. So, if you can't use your nose, then, you have the mouth individuals, and then travels to the lung, right? In the lung, so you have the respiration and then the exchange of oxygen and carbon dioxide between the outer air and the lungs, right? And then you have the lower level, so those are the alveoli. All right, next slide. All right, so again, the function of the respiratory system, it performs ventilation and respiration, and acid-base balance, speech, sense of smell, and fluid balance. So what is ventilation? All right, so ventilation occurs as the air moves into and out of the respiratory system. And this happens through the process of inspiration and exhalation. So inhaling and exhaling, right? During this ventilation process, the structure of the respiratory system, there's filtering and humidity of the air that enters, right? And respiration, on the other hand, occurs as oxygen and carbon dioxide are exchanged at the level of the alveoli, so that bottom sac, right? After the respiration occurs, here you have the circulatory system that is responsible for transporting the oxygenated blood into the tissue of the body, all right? And then you have the acid-base balance, like I said. So here you have the exchange of carbon dioxide for oxygen in the lungs, and then the renal secretion of bicarbs, to maintain the body's pH between 7.35 to 7.45. Mind you, the scale is 0 to 10, and 7 is neutral. 0 to 14, 7 is neutral in the middle, but the blood pH is normal is 7.35 to 7.45. This is important because it's going to help you when you start getting into your acid-base imbalances, right? If the carbon dioxide level rises within the body, so what you have is there's a decrease in the pH level, right? So you have too much acid, so that's going to go down to try to compensate. But if the carbon dioxide levels decreases, this results in an increase in the pH level, which would, an increase in pH level, high pH, then means alkalosis. Low pH, acidic. So remember I told you 7 was a neutral. So anything less than 7.35, it's considered acidosis. Anything greater than 7.45, it's considered alkalosis. All right? All right, speech. So how does speech play a role with the respiratory system? So the movement of air through the vocal cords, right, allows for the words to be formed. So that's important. It's important for you to understand this anatomy and physiology because as you start having conditions, that affects, the airway, you should consider that somebody may lose their speech, and this could be very devastating, right? The sense of smell. For the sense of smell, again, the movement of air that's through the nose allows an individual to smell the odors in the environment. And this is critical because if you can't smell, then you won't know certain things that are happening, like fire, right? And then you have fluid balance. So water is still excreted through the respiratory system. That is a form of insensible fluid loss, not sensible. Insensible, because sensible is like through urination, right? So water is excreted as water vapors through the exhalation process, so insensible. right? This helps to maintain the body's fluid balance in the tissue of the body, right? This movement of the movement of oxygenated blood into the tissue is known as perfusion. All right, next slide. All right, and so again, more anatomy and physiology. So you have again, air travels through the upper respiratory system to the lower respiratory system. We already talked about the upper respiratory system and what that includes: the nose, the mouth, your sinuses, right? Your pharynx and your larynx. Those are all upper respiratory. In the lower respiratory system, you are, you're thinking about your trachea and the lung. That makes sense, right? Next slide. So this is just an anatomy, an illustration of what we just discussed, the upper and lower respiratory system. Next slide. All right, so now on this slide, we're talking about the physiology of the respiratory system. And here you're referring to inspiration, expiration, respiration. We've already defined what respiration was, but inspiration occurs when there is a stimulation of the pharynx nerve, right? And this nerve is responsible for the movement and contraction of the diaphragm. So that's important. The diaphragm has to move because it helps with breathing, right? It's the major muscle of breathing. So if there's an injury to the diaphragm, you know that the respiratory system is going to be compromised, right? So this contraction causes the diaphragm to lower, right? And then compressing the abdominal content and pulling the parietal pleural down to allow expansion of the chest cavity. So it helps expansion of the chest cavity, right? And then expiration is a passive process that occurs as the diaphragm relaxes. Passive. It's just, it's not an active process. It just happens, right? You can't tell it not to happen. And again, respiration is the exchange of O2 and CO2 at the alveoli level. All right? And then you have areas that are considered dead space. And these are areas of the tracheobronchial tree that do not participate in any form of gas exchange, right? It's referred to as dead space, right? Both the dead space and the shunt result in something called the ventilation perfusion mismatch. Next slide. All right, so assessment, it's really, really important. And remember, you learn about the nursing process, and the nursing process has their steps. So you have assessment. After assessment, you have diagnosis, planning, implementation, and evaluation. Assessment is really, really important because if you collect the data very well, you can help identify the correct problem. So assessment is collection of data. And you're going to collect this data two different ways. You're going to collect it by just asking the questions, so that's called subjective data, or you're going to get data by you doing an objective data. So you yourself are validating the information, or someone else in the healthcare profession has validated the information that the patient is telling us. So subjective is what the patient is telling you. Objective is data that is validated and measurable per se. All right, so let's collect some information. Somebody comes in and we're talking about the respiratory system. It's really, really important for us to collect history of present illness. So they come to you and they say, I'm short of breath. So that is history of present illness. We want to gather more information. So here you want to get information such as, so tell me the onset of the issue. When did you notice this? And is it continuous or is it intermittent? And what are some of the factors that may exacerbate, the symptoms that you're expressing to me? What are any other associated symptoms with it, right? So you have pain, cough, weight changes, dyspnea. It's really, really important, to elaborate more on this. Did you try any treatment for it? Oh yes, I was coughing and then I took a cough syrup over the counter. And what happened when you did that? Did it get better? Yes, for a little bit, and then it gets back worse. So pain, generally, there's no pain per se, but it could be pain from coughing, but definitely a cough You want to find out, this cough. Tell me a little bit more about this cough. Is it productive, right? And if it's yes, what is the output? Is it yellow looking? Is it green looking? Is it red looking? All of this can tell you different characteristics. Weight changes, and that's critical because you're concerned generally if there's weight change, and you have other constitutional symptoms, maybe cancer is involved, right? So weight changes, and usually weight change that is less than what it used to be. And of course, dyspnea. Now, is this sudden? Because if it's sudden, and then you start looking into, is this maybe a DVT? And is there wheezing? So you ask about other adventitious sound that you may be experiencing. So you're going to collect a lot of data. You want to get good data because that's going to help you find out or create a nursing diagnosis in this case, or help the practitioner come up with a medical diagnosis, right? Next slide. All right, and then you want to ask about history. History is really important for every system, right? So you want to find out about the current medication that the patient is taking. Are they taking albuterol? Okay, yes, I am. How often are you taking it? Oh, I take it every hour. Well, that should be concerning because albuterol, PRN med is not supposed to be taken every hour because, it's every 4 hours, when you need it. But if a patient has to take it every 4 hours, then it means that maybe their baseline drug is not doing what it needs to be doing. So therefore, their asthma is not under control. So you want to change that, right? Other drugs that that they may be taking, all the different cardiovascular system, and you want to ask, are these drugs? Most people think prescription drugs are drugs. Well, over the counter, there are drugs that are over the counter that used to be prescribed, they're no longer prescribed. So you want to ask about drugs over the counter. You also want to ask about drugs that are alternative therapy that they use, because there's certain drugs that are contradicted or drug interaction. So it's really important to get a good history on that. So herbal supplements, vitamins, over-the-counter medication, like I said. And then you want to ask about allergies. Allergies not just to drugs, but you want to ask allergies to the environment, to food, and not just ask, but say what happens when you take it, right? Oh, I'm having diarrhea. Oh, I'm having nausea. These are usually not true allergies, right? But oh, I have hives. Tell me more about that hives and what happened. What do you have to do, when that happens? And then you want to ask about past medical history, and this include everything that is previous respiratory infection and chronic diseases, that they may have, even congenital stuff. So like someone who has cystic fibrosis, you want to ask about that. Any previous surgeries that they may have potential impact on the respiratory system, right? It's really important because remember your assessment, if you're doing a focus assessment, the questions that you ask will focus on that particular system. And of course, family history, you want to see if there's any respiratory illness that increases the patient's genetic predisposition for this illness. And then any occupation, because there's certain occupation or area of residence that may contribute or worsen someone's respiratory, condition. Those people that were exposed to asbestos, back in the days, construction workers, before the 1980s when they make it mandatory that those buildings, the material is changed, and you want to look at their social history. Is there any smoking, especially smoking, right? And you want to know how many pack years of smoking do they have, any other illicit drug use, and then recent travel. It's really important, especially out of the country, because there are areas that are more predisposed to respiratory infectious disease, such as TB, right? Next slide. Right, so you collect all this information, and now the next thing is for you to do the physical assessment, which is the objective data, right? So physical assessment has steps, and these steps are inspection, palpation, percussion, and auscultation, right? The most frequent technique that is used by most every healthcare provider who uses the physical assessment is inspection. And then the least used technique is percussion, right? We inspect, nurses inspect a lot, nurses palpate a lot, nurses auscultate a lot. So it's really important for you to understand the differences in this, right? So inspection is the first step in the nursing process, right? You do that first before you start touching the patient, right? Because in that inspection, you're talking, you're trying to develop rapport, right? Before you touch. So you're going to assess the respiratory system. So you're going to look at any abnormalities in the patient's consciousness, right? Because if you don't have enough oxygen, they may not be alert, right? And orientation, because that can indicate hypoxia, right? And then palpation, this is when, the nurse should, you start off with light palpation, right? So you're going to palpate. What are you palpating for the respiratory system? You're going to palpate the trachea, right? It should be midline to ensure that it's midline and non-tender, right? And then following the palpation of the trachea, then what you do is you palpate the anterior and posterior thorax, right? So the chest, and you're going to assess for pain. You're going to assess for crepitus, like popcorn like. You're going to assess for masses or any chest deformities, right? Sometimes the septum can be deviated inward, right? The spine could be curved, right? Because all that would probably impact your respiratory function, right? And then the next thing is percuss, and this is, you're going to percuss between the ribs, and should be performed after you palpate. And usually the normal percussion sound over the lung we refer to as resonance. Right now, see what I'm doing? I'm tapping on the table. That is percussion. You can tell if someone is hyperresonance, because those individuals who have COPD, it's louder, hyperresonance. So that resonance will be louder. So what you need to do is to go online or even utilizing your textbook and listen to the different types of resonance sound, right? And then the next one is auscultation. Auscultation, the diaphragm, you're going to use the diaphragm to auscultate the respiratory system and compare the sounds between the right and left lung, right, during inspiration and expiration. So when you are auscultating, you're trying to find out, are there any adventitious sounds such as wheezing, such as rhonchi, such as crackle. So you're listening, okay? Next slide. All right, so ABGs, we're talking about our diagnostic test here. ABGs is very commonly used, and it helps to determine the oxygenation status, right? So when you get the ABG results, you're going to look at partial pressure of, the CO2, right? So carbon dioxide. You're going to look at the partial pressure of oxygen, so O2. And you're also going to look at the bicarbonate, HCO3, right? You're going to look at the levels. So the blood gas can be used, to determine if the patient is in acidosis, respiratory alkalosis, right? Because acidotic condition or acid-base imbalance, there's two categories of it, right? It's either it is respiratory related or it is metabolic related, right? So anything that has to do with lung, if there's going to be acid-base imbalance, it will be respiratory. It's either respiratory acidosis or respiratory alkalosis, all right? And then you can also do the pulse ox, which is generally, by the way, the ABGs is done by the respiratory therapies. The blood is obtained from the arterial line. It's not a venous draw, right? Because you want to see the status of your oxygenated blood, right? Okay, so the pulse ox, it's a wavelength, right? It utilizes wavelength of light to measure the saturation of hemoglobin with oxygen, right? It's non-invasive, so which is good. So it monitors, and it's generally used very commonly. All right, typically device, so that's again, it's common. You usually use your fingers for you to measure it. It's non-invasive, which is good. Next slide. All right, and then you can also do sputum analysis. Sputum analysis is done because we want to see if there's any type of microorganism and any abnormal cell growth, right? If it's identified, then if it's bacteria, then you treat it with an antibiotic, right? But before you do the treatment, it's good to do a sensitivity test, right? To determine, okay, is this antibiotic going to be effective? Is it an effective therapy, right? And also the sputum can be used to analyze and see if there's TB, to see if there's any other cells that are malignant as well, right? And then you have chest x-ray, radiographic diagnostic studies, and you could do a an x-ray of the thorax, that may identify problems of the lungs. It may tell you about the heart or the pleural space. They're normally a first line diagnostic. So when something is wrong, instead of spending a CT scan, they want to do a chest x-ray, right? Patient is whatever complaint that they have, and it's usually less expensive. And then you have pulmonary function tests, which would help evaluate the lung functions, the volume, to determine the functioning of the lung, right? The patient, usually in this test, the patient is asked to inspire and exhale through a mouthpiece, right? And then during the test, the patient is also given instruction to alter their breathing pattern, so allowing for us to use different tests to be obtained, right? So make sure you review that. And then next slide. Yeah, bronchoscopy, right? Bronchoscopy is also good. It allows for direct visualization of the respiratory tract, right? So you can see, right? Because scopy, they're going to look in, right? Secondary to the level of the secondary bronchi. Two types of bronchoscopy. There's flexible and there's rigid. The flexible are used to take tissue specimen, or replace the ET tube. And then the rigid type is used to remove obstruction or large amount of secretion from the respiratory tract. Clearly, bronchoscopy goes through the mouth, so we got to make sure that the gag is numbed, right? So part of your nursing role and function is to make sure that the gag reflex, and usually some patient is constantly sedated, they come, you got to tell them, somebody else, if this is an outpatient procedure, somebody else needs to take them home, so they can't drive. And then you also need to make sure that the gag returns before you introduce any fluid because of aspiration. And you have thoracentesis also used, and again, they use as a diagnostic test or treatment depending on the disease process. And what happens with the thoracentesis is that a needle is inserted in the pleural space to remove a specimen or excessive fluid or air, right? So clearly after the procedure, you probably want to make sure that the patient is not on the side where the procedure was done, right? Because you want the lungs to expand. So you want to put them opposite the side where the procedure was done. And of course, biopsy. So lung biopsy is one way, is the way to diagnose cancer. And so it allows, the practitioner to remove, and analyze under microscope, any problems. Right, it's performing the basis on the location and size of the tissue that requires the biopsy, right? And of course, the biopsy can help us confirm the lung cancer, sarcoidosis, or pulmonary fibrosis. So consent is definitely needed for this, for all this procedure that they've given us consent. Next slide. All right, so respiratory symptoms, there are some changes with age as individuals get older. So you got to keep in mind of that. They're already predisposed to a lot of respiratory conditions, usually due to this. So the thoracic cage stiffens, the height of the thoracic vertebrae, changes. So there are, they have kyphosis, they have osteoporosis, the chest wall is not as compliant. Their diaphragm decreases in strength. There is a decrease in the intercostal muscles. There is decrease in elasticity. There's an increased potential for bronchial constriction. They have more episodes of hypercapnia and hypoxia. They have delay in gas exchange. They have increase in neutrophil. And they have a decrease in the macrophages in respiratory system. So when you think of the respiratory as a summary, it's important for the nurse to collect information before you start, completing a objective assessment, because from the assessment data that you've collected, you'll be able to derive a nursing diagnosis. So it's important to understand how to collect the information and how to do your assessment finding, and collecting the information that is absolutely correct. All right, so that ends the assessment of the respiratory system.